Okay, in this second screencast, we're going to move along to look at some of the practicalities in relation to goal setting. So firstly, it is about whether that person is ready to do that. So it's a logical step for those who clearly are ready to make behaviour change. But first, we've got to make sure we've investigated what's going on, we've done our assessment, we've found out what the nutrition issues are. We also need to affirm the things that don't need changing. So if we have somebody who's newly diagnosed with type 2 diabetes and they already eat regular meals, then that's a really good thing to affirm. If they already eat sufficient number of fruit and vegetables, we need to affirm that. So that's a really important step to take. And we need to be mindful of understanding that person well enough, having used our person-centered care skills, to make sure this is the right time for them to be making changes. So we need them to make changes, perhaps to improve their diabetes control, but we also need to be sure that they are in a position at this time to make those changes. And behaviour change really is quite a complex thing to achieve, and goals can help us to break it down into bite-sized chunks. The goals might be related to diet, they might be related to physical activity, but they might also be related to some other health-related behaviour, like alcohol consumption, for example. And people often need guidance with the appropriateness of the goals, because we have to bear in mind, in line with our BDA model and process, that we have an aim of treatment. We are trying to do something quite specific. So the outcome of the goal has got to relate to the nutritional problem that we have identified. Goals can really help us with monitoring our progress towards that outcome, and goals need to be agreed. So it's that person-centered, working together, collaborative, together you've come up with a goal that is going to be appropriate for that person. So what do we need to think about? One of the reasons we spent time thinking about medical conditions and how food relates to them is because people need to understand that in order for their goals to be meaningful. So they need to understand how my current lifestyle affects my medical condition and therefore what the changes are going to do. So that's where we might introduce our medical condition. So, would it be helpful to spend a little bit of time talking about what diabetes is? So that's our EPPE, if you remember. The BDA and Health Education England, Nice Guidance, all say service users should be active participants. So the contrast here is, rather than us saying, well, what I think you need to try and do is have sweeteners in your coffee instead of sugar, is, I wonder if you've made any changes already or have any ideas about what you might do differently. So sometimes people have already thought, I wonder if that would work, if that would be the right thing to do. So we need to explore and bear in mind that people may have had a time lag between their diagnosis and them seeing us. So they may already have made quite profound changes, and we need to explore that. So we can help people to understand the importance of change and support them to engaging with the goals that they need to make. But that link between the medical condition and diet is really important. So Holly and Bito suggest this 4-part process of identifying what the goals are. So we're looking at appropriate and feasible areas for change, checking importance and acceptance. So we might be using an importance ruler there. And what they suggest is that if it's 5 or less, it probably isn't the right goal, or there is a gap between the patient's understanding of why that goal might be important, hence our explanations. But if it really seems unimportant to the patient, then perhaps we should be looking at something else. They've got to be seen as important. Thinking through the goal analysis and overcoming obstacles is, what might get in the way of you achieving that goal? So getting people to think through realistically what it might be like. And then they come up with the idea of goal implementation. So that's the specific actions that we might need to meet that goal. So that's one way of looking at that kind of step process with goal setting. A little bit more about what some of the policy is saying. Goals should be reviewed regularly, and that's a really important thing because we don't always have that ability to review people as much as we might like to do. But ideally, somebody should be doing that, whether it is a practice nurse back in primary care or something like that. So they should be reviewed regularly and revised, bearing in mind the progress is made. Because it might be that someone's made some changes and those changes have now become habit and now they're ready to make some other changes, or that the goal didn't work and for some reason they need to think of something else. We very much need to be individualising. That's a nice guidance on adult services. And an action plan needs to be in place to help that person develop the goal in a way that's actually going to be meaningful. So what's going to happen, what situation, what time, how often, how long, where's it going to take place? So the more detail in the goal and getting the patient to spend some time thinking it through is going to be really helpful. It's time well spent. We may use the acronym SMART, which I'm going to come on to talk about. And sometimes people use what, how and when. So what change is going to happen? How's it going to happen? And when's it going to happen? But we do need to make sure if we use that approach, it's still very specific and measurable. So you may well have seen the idea of SMART goals. In fact, I'm sure you have. And there are more than one way of writing these. And I just wanted to kind of highlight that to you, really. Specific is always there. Measurable is always there. But what the A and R stand for is there's variations on that theme. So some people will call it achievable or attainable. So something that people can actually do. Some like the idea of reward and what reward someone might get for achieving a goal. The alternative is an appropriate goal. So that would be one that is going to make a difference to that clinical outcome you're aiming for. And some will put R for realistic, which is also the same thing as achievable. And all of them would say it's time-based. So let's just have a little bit more of an explanation of what that means. The specific is a bit more of that what, how and when. What needs to be clear, i.e. not just decrease fat intake, but decrease fat intake by changing cooking methods, changing milk, changing fats, those kinds of things. So there needs to be something quite specific that's going to be changed rather than a kind of vague, let's decrease my fat intake, because how much decrease of fat intake is enough? It might be that that person has changed from full fat to semi-skimmed milk, but they only have 1 pint of milk a week. Well, it make no difference at all. So it needs to be really specific. The measurable links with the specific. So it's something that is really concrete and observable. So you can say, yes, I have made this change. Did I just have chips once a week, or did I still have them 2 or 3 times? So has the person achieved that or not? And we can measure it, we can tick it off and say, yes, that's been achieved. Goals I'm using the appropriate and realistic version of SMART, goals clearly linked to the desired outcome. So it's got to be something that's going to make a difference to the medical condition that we are trying to manage. The realistic is about what that service user feels is doable. So they're reasonably confident. Again, importance and confidence grid might be helpful. They're reasonably confident about the goal, and it is person-centered. It's not something you've imposed on them, something that they have agreed. So realistic stroke achievable. There's no reason why people can't reward themselves for achieving things, but what you really do need to be mindful of, if you're thinking about this, is to be sure that the reward is not food. It needs to be something different. And time-based. When is it going to be done by? A clear end point. So an example for the communication might be, explaining the basics of goal setting. first and why it's beneficial. Finding out the service user's ideas of what they would like to tackle. And this kind of follows on really well from your spot the difference part of the consultation. You've identified areas that don't meet the recommendations. Which one would they like to focus on? And sometimes you can just brainstorm ideas or use an options tool and just list, or you have a tool with pictures, circles on it, boxes that people can put in the areas that they might want to change, and then to decide which one they want to focus on first. Sometimes people will struggle to identify goals and might well need your support. So we might be using phrases like, there are several options for action that you could consider. You're the best judge of what will work for you. And we can work together to review the options and select the best course of action for you. And it might be they say, well, which one's going to make the biggest change to my symptoms the quickest? And it might be that if they are someone with type 2 diabetes who's symptomatic, newly diagnosed and symptomatic, that actually tackling, and they eat a lot of sugary foods, and tackling sugary foods might be the first option. But it's about whether they can do that as well. Is that something they feel they can take on board? So you're going to have that kind of discussion with people. So just here's an example for you. So you've made the decision to increase fruit and vegetable intake, which will help you to increase your fibre intake and relieve your constipation. Can we work to make this a bit more specific so that you know how much to aim for? We know that having clear goals can really help people to make lifestyle changes and maintain those changes. So that's a very brief explanation of why goals are useful. And then we can say, for example, here's our spot the difference. We've identified that you currently have about 2 portions of fruit and vegetables per day, and the recommendation for is at least 5. What do you think you could manage? So we're talking through what the recommendations are. We're talking through what they do. What level of change do they think they could make? Also building on positive experiences or successes. You said that in the past you always had at least 1 portion of vegetables with every main meal. Is this something you could do again? And then talking through a little bit about what plans might need to be in place. So, in order to meet your goal for having at least 4 portions of fruit and vegetables at least 5 days a week, you may need to plan what you need and to go shopping. When do you think you could achieve that by? Some people just go shopping once a week. They have a set routine on how they do those things. So they may have to think about it. They may need to go back and plan their meals and think what the shopping list needs to include. So there may be things that people need to put in place before they can start working towards that goal. So we might end up with a goal that, for example, is to increase fruit and vegetable intake to at least 4 portions on 5 days a week. And this will be achieved within 2 weeks. And therefore people can monitor that to see if they're doing it. It's very easy. Yes, I achieved it. No, I didn't. Tracking techniques are something that people can put in place to help monitor their progress towards their goal. So firstly, we need that really clearly written goal, which you'll need to write and they'll need a copy of, and then decide on how the progress is going to be monitored. And that could be, some people like to write things in journals, some people like spreadsheets, someone's just a scrap of paper on a note on the fridge. Some people would prefer to use apps. It's about working, whatever works for them, it doesn't matter, as long as it's recorded in some way. So encourage your service user to choose their own tracking techniques. And in preparation for the session, I just want you to think through some appropriate goals for the medical conditions we've been focusing on or explaining over the last few weeks, because we will use these in the session. So we're going to think through with type 2 diabetes, celiac disease, and malnutrition for someone who's in need of nutritional support, which can be given by food or oral nutrition supplements. We don't want to go down the tube feeds type route. So have a think. We will be doing some activity in groups in the session to work on some of these and to get some really smart goals that might work for patients.